The committee set up by Delhi government to look at the coronavirus mortality rate and spread in Delhi has submitted their reports to CM Arvind Kejriwal. The Chief Minister has in turn asked the Health Department to take all measures to bring down the death rate to zero in Delhi. Kejriwal had set up multiple committees to analyze and study the high mortality rate in the 10 dedicated COVID-19 hospitals of Delhi. A checklist of guidelines by the Health Department was given to these hospitals on July 16. Delhi government says after the implementation of the guidelines, death rates have further decreased in the national capital. Arvind Kejriwal called for a meeting on Wednesday with the committees that monitored 10 hospitals in Delhi in July to study the reasons behind the high coronavirus mortality rate. During the inspections, these teams found that the death rate in all the hospitals have decreased as compared to the previous months, said the Delhi government. CM Kejriwal has said that the health departments and the committee must further bring down the death rate to zero. Government says that the checklist given to the 10 government and private hospitals have shown positive results, due to which coronavirus deaths in Delhi have come down to just 11 as of Wednesday. Review committees were formed for Lok Nayak Hospital, GTB Hospital, Safdarjung Hospital, Max East and West Hospital, Gangaram Hospital, RML Hospital, Jaipur Golden Hospital and others. The inspection teams also proposed suggestions and measures in order to reduce the COVID-19 mortality rate. The GTB hospital was to equip the COVID-19 wards with HFNO-BIP machines for early intervention along with early recognition and transfer of sick patients to ICU. Increased use of convalescent plasma early in treatment was also suggested. Similarly, Safdarjung Hospital was told have scorecards to be used for detection and shifting of patients from the wards to critical care units. Another recommendation that came from the Safdarjung team was that high-risk cases should be transferred to ICU and HDU when the earliest signs of deterioration in a patient shows. The team at LNJP Hospital said early warning scorecards should be used to ensure prompt detection and high-risk cases should be transferred to the ICU. The committees formed at private hospitals like Gangaram recommended that early detection of complications in patients kept on prolonged ventilation is needed. The Delhi government has said that all the recommendations are being reviewed and will be implemented for other hospitals in Delhi as well. In the past few weeks, coronavirus growth rate in Delhi has witnessed a declining trend and the number of active cases have now reduced to less than 10,000.